I was 38 years old. I did not feel like I was a candidate for a heart attack. My life was very stressful. There were some days I would feel like I was having a lot of anxiety. I was concerned because I was having some jaw pain, and I went to see my ENT about that, and then I also saw my primary care physician, and they decided that it was anxiety. It was a Wednesday. Jeff and I were contemplating going to lunch at about 2:15. I took a shower, and I was telling my husband, you know, my chest is a little tight. I think I'm having a little bit of indigestion. 10 minutes later, I was just doubled over in chest pain. Well, I can tell you I called both of my parents and told them I'm having a heart attack. We're on the way to the hospital. I knew I was having a heart attack. I had multiple heart attacks, so they put 4 stents in my heart, and I was lucky to be there at the hospital when that happened. The biggest takeaway from this for me is I would not be here today if I hadn't gone to the ER. I didn't think I had any chance of having any heart problems because I didn't have some of the other issues like blood pressure, like cholesterol, some of those things that would indicate some sort of a blockage. I didn't have any blockages, but I still had a heart attack. The symptoms I was having were not something that I absolutely could not have brushed off. If I wanted to, I could have just moved on. I would have been super uncomfortable, but I could have just moved on and died. My message to women would be, if you feel like you're having a heart attack, you're having a heart attack. Go to the hospital. While I was in the hospital, the first doctor that rounded on me was Dr. Avery. She was absolutely amazing. I would say that the Heart Institute is the best place to go if you want excellent care, an excellent cardiologist. I would never want to be away from Northside Hospital for the rest of my life because of this. I would always want these doctors to care for me, and I wouldn't be alive if it wasn't for them.